Dr. Stone. Hi, Dr. Gaudino. Can you please tell me a little bit about your backgrounds?
Sure. I'm Gregg Stone. I'm an interventional cardiologist and a professor of medicine and the director of academic affairs at the Mount Sinai Heart Health System here at Mount Sinai Hospital in New York City. And for approximately 40 years, I've been taking care of patients with coronary artery disease, performing angioplasty and stent procedures in stable patients, patients with heart attacks, all kinds of patients. And I've also been spending a lot of my career investigating the best ways to treat patients with coronary artery disease. And in that regard, for many, many years, I've been working with my colleagues who perform cardiac surgery because some patients are best to have cardiac surgery and some patients are best to have stent procedures, which we sometimes call PCI. So it's my pleasure to be working with Dr. Gaudino, my cardiac surgical colleague, and together we have designed and are helping to run the RECHARGE trial.
So I go next. My name is Mario Gaudino. I am originally from Italy, from Rome. I did all my training in Italy, and then I moved to New York approximately 10 years ago. I'm a cardiac surgeon by training, but in particular a coronary surgeon, and I've spent all my career doing bypass surgery in different iterations to treat a patient with coronary artery disease, exactly as Dr. Stone. I have also a passion for clinical trials. I am professor of clinical epidemiology, and I, like Gregg, I have spent a lot of time during my career investigating which surgical techniques works better in a patient undergoing bypass surgery, or like in this case, when surgery or other intervention are better. And it's my absolute honor and privilege to work with Gregg on this very innovative and important trial, a trial that many felt was impossible to do. But Gregg and I don't like the word impossible, and that's why we are trying for the first time to generate high quality evidence in patient group that have been too long underrepresented in other cardiac and cardiac surgery trials.
Yeah, so I just extend that, Mario. The RECHARGE is such an important study. For many years, Mario and I and many other people around the world have been working collaboratively to try to figure out which patients should undergo stent procedures, which patients should undergo bypass surgery. And this is a big decision because these procedures affect people's lives and their longevity and their quality of life. But most of the patients that have been enrolled in these prior trials have been white men. And we've been particularly bothered that as two people who rely on clinical evidence to help make treatment decisions, we really don't know what is better for women and what is better for minority group patients who have been underrepresented in these trials, particularly Black patients and patients of Hispanic ethnicity, who we know are higher risk and tend to have higher event rates with both surgery and stent procedures. So it's my honor to work with Mario, and together we've again designed and implemented the RECHARGE trial to once and for all focus our efforts just on the patients that need it the most, and that is women, Black, and Hispanic patients, to determine which procedure we should try first. That is stent procedures or bypass surgery procedures in the majority of those patients.